Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Fear of falling can become a serious concern as we age. With me today is physical therapist Molly Torbitt, who has studied how valuable psychological assessments may be in addition to physical function when assessing someone's fear of falling. Dr. Torbitt is an assistant professor of physical therapy in Upstate's College of Health Professions. Welcome back to The Informed Patient, Dr. Torbitt.
Thank you for having me back.
Is having a fear of falling normal for humans?
Yes, it is normal. It exists kind of on a continuum, right? So some people might have more risk factors for falls and therefore be more fearful of falling. And I think that those people have very good reason to be afraid of falling. And so that fear can range anywhere from being mindful of being outside on slippery roads to a full-blown avoidance of activity because of that fear. So the strength of the fear can vary from person to person, but it is fairly common. People who have past falls are often found to be more at risk of developing fear of falling, but also anybody can develop that fear at any point in their life. If somebody has a fracture or a surgery, they might have more of that fear than just anybody going about their day-to-day activity without those risk factors.
Do you think it's normal for a fear of falling to become more pronounced as we get older?
Yes, age is definitely a big factor. With this particular research project, it was consistent with existing bodies of literature that support that people who are older are more at risk for falls and have also been shown to have more fear of falling. Women tend to report more fear of falling than men. Women also tend to be found a little bit more of being at risk for falls as well.
So what made you want to investigate fear of falling?
So this actually goes back to my dissertation when I was working on my PhD. So at the time I was working as a clinician and I was starting to have patients saying, I'm really afraid of falling. As I'm getting older, I had a family member fall and then things kind of went downhill for that person. And I really don't want that to happen for me. And then it kind of just morphed into my dissertation, which was I interviewed caregiving dyads. So I interviewed an older adult and their caregiver. And I did a qualitative, it's called a phenomenology, where I interviewed them multiple times to really get down to the kind of nitty gritty of what their experience with fear of falling was like in their day-to-day activity. That was a really fun project that I got to work on. So that kind of started it. And then what I find super interesting about it is there's so many different avenues to pursue with it. So we have the caregivers and the older adults. What are they actually feeling? How are they experiencing it? And then I have this project. And then another avenue I see myself pursuing is actually looking at, are the healthcare providers, so I'm a physical therapist, right? Is that physical therapist afraid of their patient falling for whatever, maybe retribution, or they have to do an incident report? And is that affecting how challenging we're making balance exercises? So fear of falling exists on a continuum, and my research interest with it also exists on a continuum of different stakeholders in that. So that's kind of how I got into the fear of falling world. I feel like this fear of falling is such a universal experience for folks. And when I was looking at caregivers and the older adults, my dissertation advisors were like, oh my goodness, I am so afraid that my mom or my dad or my aunt are going to fall. And what is that going to mean for them? And so it's a little off topic, but with dissertation, I found that the older adults I interviewed, they weren't afraid of falling or getting hurt from falling. They were afraid of what it meant for their independence. So if they fell, did that mean somebody was going to maybe put them in institutional care? And then from the caregiver side of things, they were fearful of the older adult falling because of an increased burden on themselves. So it was like, again, just stuff I was seeing in clinical practice, but to see it supported in the research was refreshing.
Yeah, because people are thinking ahead about what the impact would be.
Right.
It is pretty scary, though.
Yeah. And that can in and of itself be debilitating for people. Just getting caught up in the what ifs. What if I fall? Can I not live in my house? Can I not do stairs anymore? How do I do my own laundry? How do I get out of the house?
How do physical therapists measure a person's fear of falling or their balance confidence?
There's a ton of different measures out there. Some are simple as asking a person, are you afraid of falling? And they just say yes or no. Then there's some more detailed instruments. So there's a couple of scales that measure balance confidence, which are you rate yourself on a scale of how confident you are that you would not fall or lose your balance while doing a number of tasks. And then there's also a fear avoidance questionnaire that could be issued as well. So as a clinician, if I'm talking to my patient and just having a conversation and I'm asking them, what does their day to day look like? And I'm starting to pick up on cues that, okay, maybe this person is avoiding activity, then I might lend towards one outcome over the other. But for this particular study that I worked on, we used the activities balance confidence scale. And that is because it has a really clearly defined cutoff score for being, not only does that person maybe have lower balance confidence, but it's also been shown to be correlated to having a higher fall risk as well. So that's why we picked that particular outcome for this study.
This activities balance confidence scale, do you use that for everyone, or is that geared toward someone who has a condition where their balance may be affected by the condition?
No, it can actually be used for anybody. There are some items on there that I'm like, yeah, I don't trust myself. I would probably fall on an icy sidewalk. So I might rate myself a little bit lower on that. And just knowing that I have to maybe be more conscious in certain situations and certain climates, we're in upstate New York. So the snow and ice are a very real risk factor for people. What's also interesting is kind of the time of year that you might ask somebody that. So if it's July and weather is not on the forefront of our mind, somebody might rate themselves higher that, no, I don't have a concern. But if you ask them January, February, when they're presented with it face on, then they might answer a little bit differently. So the context is important of when and where we're giving these outcome measures.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with physical therapist Molly Torbitt from Upstate's College of Health Professions. What made you think that psychological and social variables such as income, living arrangements, and self-reported depressive symptoms would have any impact on a person's fear of falling?
There's already a pretty well-established body of research on those topics being risk factors that dates back 10, 15, even 20 plus years. So what I was specifically looking at, right, we already know that these things can impact fear of falling, but I wanted to see, like, in this particular setting of individuals that we were working with, did those psychological and social variables, did they play a bigger role than maybe the strength variables or the mobility variables? So I took what's already been established and then I looked at which factors played a bigger role at, I'm going to say predicting, for lack of a better word, right? So predicting that fear of falling on the activities balance confidence scale that we used.
Can you walk us through how the study was conducted? Because I know you used a community dwelling, but I wasn't sure what that means.
Sure. So myself working with a large research team down in Binghamton, New York, this has been a work in progress since 2022. Essentially what we did was we went into all the different senior centers down in Broome County and we offered to anyone who was interested a fall risk assessment, right? So this particular study is an offshoot of a much larger study where fall risk is being tracked over time. So year after year, they've gone back every spring since then, and it's only grown in interest. So I think that first year we had 80 some odd people, and now they're up to like 500, and there's multiple years of reassessment in there. And so because it was being done in the community at these senior centers, these community run centers, anybody who was interested was eligible for the study. So when I say community dwelling, it's just that that individual is living freely in the community, be it with a family member, be it with a spouse or a senior living community. anybody meeting those criteria was eligible for the study. So it really just excluded individuals who were in a nursing home, in the hospital. So anybody receiving institutionalized care, they were not eligible. The individuals had to be able to transport themselves to and from the senior centers.
What can you tell us about your results?
What I found in this study was that the standard strength assessment, right? So we used a 30-second sit to stand test, which measures lower body strength. So it's how many times can a person stand up and sit down in 30 seconds. And we know strength is going to be a factor because if you don't have the strength, you might be at more risk for falling and therefore be more fearful of falling. So that wasn't unexpected that I found that. But then when I added in to the research model, the depression scores, that made walking speed become the highest predictor in this model of fear of falling. So people who walked slower had less balance confidence.
Are they walking slower because they're worried about falling?
Potentially, but we'd have to dive a little bit deeper and talk to each individual person and really try to dive down to it. That explained the most variance, we call it, in the balance confidence scores. So whether or not they walked faster or slower impacted whether or not they had good balance confidence or if their balance confidence was limited. The second highest predictor in this model was the depression scale score. So individuals who reported higher depression on this scale, they had lower balance confidence.
And that was surprising to you?
I think deep down it wasn't super surprising, but it was nice to see what I was experiencing in clinical practice come to life in the numbers. There's a pretty sizable body of literature out there about depression and fall risk and fear of falling. And really, nobody knows what comes first, right? Does the fear of falling maybe contribute to somebody's depression? Or is that person already maybe having some depressive symptoms and then they become fearful of falling? Nobody really knows yet. So that's what I can take from this current study and run with a little bit, kind of in the same population, and maybe go back to doing some interviews of participants who scored higher on that depressive screen.
Let me ask you, as a physical therapist, what advice can you offer to people who are afraid of falling? I know a lot of seniors go and sign up for Tai Chi classes. Is that helpful?
I think any sort of movement is helpful. When a person is more active, they're presented with more opportunity to fall. So it's this constant balance that a person is working with, pun not intended. But if you're out and about more, you're doing more, there's more risk to fall. So you might be falling more, but you're more active. So maybe you don't have those injuries and you know you can get up and that fear doesn't become on the forefront. In terms of advice, if you have a trusted physical therapist that you've worked with before, just having a conversation with that person, talking to your primary care doctor, and just knowing that physical therapists can help, right? There's a number of interventions, right? If somebody is truly avoiding activity because they're afraid of falling, doing a certain thing, like take stairs, for instance, somebody might be really afraid of falling down the stairs. That physical therapist can work with that patient to grade their exposure, and they do it little by little under their care and supervision to help that person become less fearful. Other time, maybe it's just an assessment of their strength, and maybe their strength is limited and you give them exercises and they feel stronger and they feel more confident that they're not going to fall navigating their day-to-day activity. So what's really nice about PT is they can tailor the intervention to the needs of that patient. And I would just say to any PTs that might be listening, doing a depression screen might be helpful. And if that person is scoring high, getting in touch with their care team to say maybe this person needs a little support.
Is there a safe way to fall?
There is, there are programs out there that teach patients how to fall properly. I'm a big proponent of taking the stigma out of that fall. I think sometimes people are like, I don't know how to get back up. So one thing I always like to work with my patients on was getting on and off the floor and building confidence in doing that. So if they found themselves in a situation where they were on the ground or on the floor, they could get back up independently. And I think that there's something super empowering in that for patients.
Well, your research has been very interesting, and I appreciate you taking time to tell us about it, Dr. Torbitt.
Happy to share, and thank you for having me back again. I appreciate it.
My guest has been physical therapist Molly Torbitt, an assistant professor of physical therapy in Upstate's College of Health Professions. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.